Let's talk a bit more about mental and behavioral health, specifically how it relates to your patient care. We will start with the common causes of mental illness and then highlight some of the most common behavioral health challenges that you will see in your work. There are many causes of mental illness, and most people have multifactorial disease, meaning their mental health conditions are not limited to one cause. We don't always know what the cause of mental illness is for someone. Early adverse experiences are potentially traumatic events that occur in childhood and can change the way people view and interact with the world around them. People with early adverse experiences are more likely to suffer from mental health disorders than others. Other chronic medical conditions, especially those that limit mobility, can lead to mental health disorders, particularly depression. Patients with chronic conditions may experience a loss of physical strength and stamina, chronic pain, or other lifestyle changes that can impact their mental health. It is important to watch patients with chronic conditions for signs of poor mental health, particularly if their conditions are worsening. Biological and chemical imbalances can also lead to decreased mental health and may require medication to improve regulation. Examples of such disorders include depression and anxiety. Additionally, alcohol and drug use can lead to mental illness. Substance use is more likely among those with existing mental health disorders, creating a cycle of abuse. And finally, feelings of loneliness and isolation can contribute to mental illness. This is particularly true when major life changes occur, such as when a spouse or loved one dies, when someone moves, or when physical changes necessitate a change in lifestyle and loss of social connections. This means that patients in long-term care facilities are at higher risk for mental health disorders because they often experience a significant change in lifestyle as well as changes in social networks. While we can't pinpoint the exact cause of mental illness, we need to be aware of some of the factors that increase someone's risk for developing mental illness. We've already briefly touched on some mental health disorders, but let's get into a bit more depth. While there are many mental health disorders, the disorders you will likely see most often as a CNA are dementia and cognitive decline, anxiety disorders, depressive disorders, serious mental illness, and substance use disorders. Dementia and cognitive decline are not classified as mental illnesses, but they are among the most common neuropsychiatric disorders you see working in long-term care facilities. We will cover these topics in depth in a separate module. As a CNA, you will see many patients with anxiety disorders. Anxiety disorders are defined as conditions that result in excessive fear, anxiety, and related behavioral disturbances that interfere with daily life. What makes anxiety disorders different from concern about normal life is the disruption it causes to daily living. People experiencing anxiety feel fear or concern that is out of proportion to the actual situation. There are many types of anxiety disorders, but the conditions most often seen in the care setting include generalized anxiety disorder, panic disorders, and phobias. Anxiety disorders can impact anyone at any time, but they often occur alongside other disorders, such as depression and serious mental illnesses. Anxiety disorders can be regulated by healthcare staff. Psychiatrists, psychologists, behavioral counselors, physicians, and nurses are all part of the care team for patients with anxiety disorders. You are also an important part of the care team. While you are not responsible for diagnosing or treating anxiety disorders, you often spend the most time with patients. As a CNA, you are the eyes and ears on the ground and can provide the rest of the care team with valuable information on the patient's condition. While there are many symptoms of anxiety disorders, these are some of the most common symptoms to look out for. Feelings of restlessness, nervousness, or tension. Sense of impending doom, danger, or panic. Rapid breathing. Trembling. Increased heart rate. Feeling tired and weak. Difficulty concentrating. Overthinking. Worrying. Difficulty sleeping. Gastrointestinal, stomach issues. You cannot help patients with anxiety disorders on your own. The most important thing you can do is to notify a supervisor immediately if any of the symptoms mentioned occur. It is important to say something to other members of the care team if you see anything unusual. You will also likely see many patients with depressive disorders in the course of your work. Depressive disorders can be caused by many things, including life events, trauma, changes in light exposure, and chemical changes in the brain. Regardless of the cause, a person cannot snap out of a depressive disorder. Depressive disorders are serious illnesses that require treatment and compassion from trained healthcare providers. What are some symptoms of depressive disorders? Symptoms include loss of interest in previously enjoyable activities, weight changes, restlessness, nervousness, a feeling of being slowed down, persistent feelings of fatigue, difficulty concentrating, suicidal thoughts, agitation, and feeling worthless. Patients with 5 or more of these symptoms lasting more than 2 weeks can be diagnosed with depressive disorders. It is important to note that depressive disorders may look slightly different in older adults. Older adults may exhibit changes in personality, cognition, and memory, complain of new physical pain, and experience changes in appetite, sleep, and energy levels that are not connected with other physical or medication changes. Like with anxiety disorders, as a CNA, you are part of a larger care team and provide other clinical staff with invaluable observations on the patient's physical and mental well-being. If you notice any changes in the patient, report them to a supervisor immediately. If you see something, say something to a supervisor. While less common than anxiety and depressive disorders, up to 10% of residents of long-term care facilities have serious mental illnesses, or SMIs. You may encounter patients with SMIs, including patients living with schizophrenia, bipolar disorder, obsessive-compulsive disorder, post-traumatic stress disorder, and borderline personality disorder. Again, you are not responsible for diagnosing or treating patients with SMIs, but you are an integral part of the care team. As with anxiety and depressive disorders, you are on the front lines of patient care and likely to notice changes in resident physical or mental health before other staff members. If you notice changes in a patient's mood, appetite, sleep, breathing, or mental clarity, you should immediately notify a supervisor. If you notice anything out of the ordinary in a patient's room during the normal course of your work, you should also report these changes to a supervisor. Examples of changes to look out for include storing or gathering medication or other materials, keeping food items, and changes in hygiene or toileting habits. You provide vital information to other members of staff that help to keep staff, patients, and other residents safe and healthy. And finally, substance use is a behavioral health issue that you may encounter in your work as a CNA. Substance use disorders are treatable, ongoing conditions that are characterized by repeated use of substances that lead to health and social issues. They result in a pattern of physical, cognitive, and physiological symptoms. Substance use continues even after negative consequences emerge. Treatment is available and recovery is possible. Substance use disorders can involve any substance that negatively impacts a person's life. Because the possible substances vary widely, the symptoms associated with substance use also vary. Some general symptoms include confusion, neglecting to eat, withdrawing socially, changes in mood and behavior, risky behavior, hostility and denial when confronted about substance use, and an unkempt physical appearance. Many people with substance use disorders are also living with other mental health disorders, including anxiety, depression, and serious mental illnesses. The important point to remember is that if changes in behavior occur, you should say something to your supervisor. As we have noted already, CNAs are not responsible for treating patients with mental illness, but as a CNA, you can provide comfort and stability in otherwise stressful situations. By recognizing shifts in the patient's moods, listening to the patient themselves, and informally identifying triggers for the patient, you act as the eyes and ears of the healthcare team. There are a number of strategies for improving your patient's well-being and mental health. Let's begin by outlining some support strategies, and then in the next slide, we will highlight some actionable items for each of the strategies. First, communicate openly with your patients and respect their desire for privacy. Second, build a relationship with your patients. You are not their family member, but you likely have more interaction with many of your patients than their immediate family members do. By building a relationship with your patient, you encourage trust and increase the likelihood that your patients will share information on what is troubling them. You can also make the environment as comfortable as possible to elevate the patient's mood and reduce tension. Through your daily duties, you provide patients with a sense of comfort and stability and help reduce loneliness and isolation. As you develop relationships and care for your patients, you need to consider your own emotions and mental health. Be careful not to share frustrations with your patients and always maintain a calm and professional demeanor. Maintaining your own composure will help stabilize your patients' moods and bring a sense of calm to their environment. Having a list of support strategies can be helpful, but finding ways to incorporate them into your everyday activities is also important. Let's discuss the strategies listed on the previous slide and actionable ways you can include them in your work as a CNA. First, communicate openly with your patients. This can be a challenge when you are in a hectic and often understaffed environment. One way to increase communication with a patient is by asking open-ended questions and waiting and responding to the answer. Open-ended questions are questions that require more than a one-word answer. These questions often lead to follow-up questions or further conversation. Open-ended questions can include asking a patient how they are feeling that day. This question is simple but demonstrates real concern and gives the patient an opportunity for human interaction. Building off the previous item, building relationships with patients can help you support your patients. Many patients have few visitors, and this lack of human contact may leave them feeling lonely, isolated, and stressed. You can help reduce that stress by making your interactions with the patients pleasant and friendly. Building relationships starts by demonstrating that you see the patient as an individual. Using their name, first or with a formal title depending on the preference of the patient, is a simple way to demonstrate that you know who someone is and improve the connection between you. Creating a comfortable environment includes the physical space in which your patients reside. Creating a comfortable environment is specific to each patient, so try asking your patients if there is anything you can do to improve the environment. Patient preferences may include pillow placement, light level, music, etc. Each of these things may seem small, but when combined and addressed, can make a big difference for your patient. Providing comfort and stability is an important part of providing support. Many patients are in unfamiliar and potentially confusing environments. Staff change several times a day, and it can be difficult for patients to develop relationships. By respecting their privacy and preferences, you provide your patients with a stable environment they can depend on. Many of your patients may feel loneliness and isolation. First, do your best to limit judgment of their situation and their feelings. All people, including your patients, are entitled to their feelings. Engage and interact with them in a friendly and professional manner. The last thing you can do to support your patients is to manage your own personal emotions. You may find yourself frustrated with situations outside of work, with another patient, with a family member, or with other members of staff. Do your best to keep those emotions outside of the patient room. Actively decide to keep interactions positive and consider planning your positive comments. Maintaining positivity with your patients will take practice, but it will get easier as you actively seek out those opportunities. Simple positive comments about the weather or a patient's appearance can improve the mood of your patient and help keep personal frustration to a minimum. Putting patient support strategies such as these into action takes time and practice. Don't expect yourself to be perfect immediately. Remember that small changes to your interactions with patients can have a big impact on your patients. As a CNA, you have the opportunity to provide your clients with emotional support through the normal course of your work. You often spend more time with the patients than any other healthcare professional, helping them with their daily tasks and caring for them. Because of these regular interactions, you can identify changes in a patient's mental state, relationships with other residents and family, and identify sources of agitation. Your observations are essential to the care team. Regardless of a patient's mental state, as a healthcare professional, you are required to maintain a professional bedside manner at all times. Remember that maintaining professionalism does not mean that you should allow your patients to cross boundaries of safety or professionalism. Your safety, both physical and mental, are always a priority. Poor behavioral and mental health can contribute to overall poor health. Increasing your understanding of behavioral and mental health in patient care helps you to best serve your patients.